This computer. There we go.
Welcome back to the Mentality Project's Mentality Mondays, Healthy Masculinity Conversation Series. I'm Magnus Dallier. I'm a senior. I'm the Mentality Project Coordinator. I'm a psychology major. And today we're very excited to be here with Dr. Archie from the Counseling Center and Logan Chapman, success coach at the Student Success Center. And we're also here with Chelsea Hill. So I'm going to pass it off to Chelsea and then we'll get started.
Hey everyone, welcome back again. My name is Chelsea Hill. I use she and they pronouns. I'm one of the health promotion specialists at the Well for Health Promotion, focusing on sexual health, sexual violence prevention, and men's engagement initiatives on campus. So glad that you guys joined us again today.
Yeah, thank you. Appreciate it.
All right, so we're here with, like I said, Dr. Archie from the Counseling Center and Logan from the Student Success Center. If y'all just want to tell us a little bit about yourselves, why you do the work that you do, what interests you, and why you're here talking to us today about healthy masculinity, that'd be awesome.
Yeah, so I'm Dani Archie. I work at the Counseling Center. I'm a staff psychologist here. And I'm really excited to be here talking about masculinity today. One of my roles is I'm the gender and sexual diversity advocate. So kind of working on different issues surrounding gender and sexuality. So I'm excited to talk about masculinity. I enjoy working with men. It's one of my, the groups that I enjoy working with in my practice. And I think partly because it can be really challenging for men sometimes to seek therapy services. And so kind of helping them overcome those barriers is one of the things that I like to be able to do, and I'm excited to be here today kind of talking about that.
For sure. Yeah. And like I said, I'm Logan Chapman. I'm one of Tulane's academic success coaches on campus. He, him pronouns. I'm really excited to be here too. I totally agree with everything Dani was saying just now. And yeah, I don't specialize in anything in particular as a success coach. It's kind of for all students at all times. However, I think just due to my personal experience and then kind of the things I've gone through in life and kind of understand about, masculinity and like men's mentality in general, I'm really excited to just hear people's thoughts and opinions about these things. So I'm really excited to be here and engage in this.
Awesome. Thank you both so much.
So follow-up question to that, and y'all's energy is just amazing, by the way. I just got it really excited. But just another question of what do you want students to know about accessing your student resources in the Counseling Center for you, Dani, or the Center for Student Success, Logan? And how frequently do you think students should be reaching out for help throughout their time here at Tulane?
Yeah, I can go ahead and kick off this one. When it comes to student success, like the Student Success Center, and everything we do really within our department, but in MTC as a whole, the one thing I encourage students, and I'm sure my students who I work with are tired of me hearing this, but I just encourage students to engage early and engage often. And it doesn't really matter what it is. So if you have questions, if you're curious about things, obviously I'm here as a success coach, and I love working with students in that way. However, I just encourage students to engage in the fact that even if it's a one-off meeting where you come in and ask me one single question about how you can get involved or just, get a resource you might need on campus, I can definitely speak for all the coaches in saying that this is what we're here for as well. Like, we want to make sure that students get what they need and what they want out of their experience here at Tulane.
Absolutely.
Yeah, I kind of similar. I think that, as far as how often should students be accessing services, I think that's really kind of an as needed. I think, but definitely, one thing that the research has kind of showed about masculine individuals reaching out for help is, for example, with depression, is oftentimes they'll wait until they've used up all their resources before seeking any help. And so they come in and they're at a much severer level than other people coming in and seeking services. And so kind of being able to catch it early and not wait until you're at your wit's end and you're kind of failing all your classes and you're just really can't take it anymore. Being able to come early is important. As far as accessing us, right now it's calling our number. It's on our website, and our patient reps, Charlotte and Belinda, really great. They'll get you set up for a consultation, and in that meeting, we'll talk about all of the resources that we have and the options, and kind of help get you set up. I also encourage students to look at our website. We have a lot of virtual resources as well, and things on there that you can access without even coming in. So.
Yeah, thank you all both so much for sharing that, especially for plugging the ways that people can get in touch with that. I definitely think that virtual sort of anonymity allows for a little bit more comfort in early access, so they don't have to wait until they use up all their spent energy, I guess, with depression or things like that. So thank you for sharing that and being encouraging. That's awesome. So both of y'all touched on having interests and passion as well as some experience. Dealing with the sort of barriers that you see masculine individuals facing in terms of help-seeking behaviors. And you touched on that very well, Dr. Archie pointed that out very clearly. So I just wanted to ask you guys kind of, what does masculinity mean to you? And how does it manifest in your work or the people you work with and the content that you are working with?
Danny, I'll let you start. It's a big question. I'm formulating in my head as well.
All right, I'll start. Yeah. So, I mean, I think masculinity is kind of defined as something that's things that are associated with men, right? But we really know that people of all genders can experience and do experience masculinity, possess masculinity. And I think it's important to remember that there's not necessarily one type of masculinity, that, you know, different factors such as age and generation and race, ethnicity, where you come from, all can impact the type of masculinity that you possess. But I think that what's really awesome is I think more and more people are learning to kind of have this opportunity to self-define what masculinity means to them. And so I think that this next generation is doing that a lot more and not kind of conforming to necessarily the traditional roles that have been kind of assigned. And so that's one way that it shows up in my work is kind of helping men in particular, but other masculine individuals kind of figure out how to have this healthy masculinity. And sometimes they may not have a lot of examples in their life to kind of look towards. And so they don't really know kind of what this looks like. And maybe they've become disillusioned with like the sexism that they see in their peers or elders in their lives. And so being able to kind of look and say, okay, I don't want to be that way, but how do I still kind of identify as a masculine person and kind of retain that? And so that's one thing that does show up in my work.
Yeah, I think that's awesome. Logan, just real quick before you answer as well, I think that's great that you brought up that there's not so much of a direction towards healthy masculinity. It seems that there's much more of a moving away from what we think of as unhealthy masculinity or too rigid and traditional masculinity. So it's excellent that you bring up that there is sort of a need for that. Logan, if you want to take it away whenever you're ready.
Yeah, no, I'm so glad Danny went first, and I think that kind of segues, and I completely agree. And I want to build off of that as well. Is, you know, for me, I can only speak to my personal experience, how I feel, you know, and I kind of look at, you know, this view of like masculinity and the fact of, you know, I want to incorporate, you know, I did grow up in a very traditional, conservative and every man of the word environment as I'm growing up. And I think and I'm sure a lot of people can relate to this, as I'm kind of taught these tenets of what makes a man or what makes masculinity, you know, that's like strength or bravery or, you know, confident and tough. And the way I wanted to incorporate that as I've kind of grown up and, you know, had time to reflect on these things is I want to embody those characteristics to a different level and more of a humanistic level, and saying, you know, can I be strong enough to look inward and reflect of like, what is this? What does that mean for me? What makes me a better human? You know, can I be brave enough to call out like friends who maybe say these disparaging remarks or make these comments about, you know, people of different identities? You know, can I be brave enough to do that in the moment? Maybe it's being confident to like take feedback about, you know, what am I displaying? Especially when it comes to maybe like women in my life, like, can I incorporate that? Can I be confident enough to take that feedback and build off of it, or just tough enough to handle that criticism, tough enough to say like, you know what, I want to grow as an individual. So just kind of embodying these characteristics in a different way, because I do think as a whole, we all want to embody those in some different way. So yeah, that's kind of how I view it in my work.
Certainly.
Great. Yeah, I completely agree with both of you guys. We embody both masculine and feminine energy, so it's awesome to hear that other people are on the same wave of moving towards how can we become just decent human beings and accept everyone for who they are. So you guys kind of already answered this, but maybe we can speak to this to a different way. But why do you guys think healthy masculinity matters, and why should it matter to Tulane students? Why should it matter on our campus?
I think, it matters in a lot of different ways. I think that, traditional masculinity in some ways, or we call it toxic masculinity, however you want to term it, can be very restricting. And, it can be very violent in many ways, and not just violent towards others, but violent towards the individual themselves. And so, we know this from kids growing up, that little kids, for example, cry the same amount until they get to be about 7 or 8 years old. And then boys stop crying because it's kind of been told over and over. And so they learn to repress those emotions. And that's violent towards their person, And so I think it's important to be able to kind of break apart those things, and both for each individual's own mental health and well-being, but also, for as a community, right? And being able to kind of come together and be a decent human being to others. And that doesn't mean throwing out everything about traditional masculinity. It may just mean expressing it in a different way. And it may be not being rigid with it. I think it's the rigidity that is kind of the problem more than it is the specific traits.
100%. Yeah. And again, I'm just building off of that. I think, I don't think any of us really, when we break it down, we don't want to be put in boxes. We don't want to be put in these one category of anything, because no one is just one category of anything. And so at the end of the day, it once we kind of start deconstructing that, we open the door to so many opportunities. And I think this is how I think why I enjoy my job so much as a coach is, like, once we can start seeing like what we're actually capable of and what you actually want to do, like what do you want, what do you need as an individual, it opens the doors to so many things. Not even to mention that, when it comes into, what especially maybe young men are taught, it kind of always implies this dipole, right? Like, which I feel like can be unhealthy for so many ways, right? If you're sitting there telling boys are meant to be strong, what does that imply towards people who identify as more feminine? Like that implies that they're weaker, which is not in any way true in any form. And so by kind of deconstructing that, pulling that away from what is classified as maybe relating strength to masculinity, by taking that away, you open the door for people to, take back their identities and not be so stuck in that box, kind of like Dani was saying.
Yeah, I completely agree with what both of y'all just said. I really think that rigidity is kind of the damaging side of traditional masculinity. It's not that traditional masculinity is necessarily bad. It's just that the way that we adhere to it too strictly is what can be so damaging and cause, like you said, Dr. Archie, sort of that violent internalization of, I have to be this way, I can't be something else. So I really like that you guys are touching on sort of being able to look within and expand your sense of who you can be and what you can be in relation to the different things that we know are out there. And I also really appreciate that you both acknowledge that these things don't necessarily have to be bad. It's just that it's the strict rigidity that makes it damaging. So it's about turning towards, in my view at least, turning towards more healthy alternatives, more comprehensive, individualized alternatives. So relating to the work that both of you do, what gaps do you see differences between students that reach out to you, if any, related to gender or anything like that? And where do you think some of these trends come from? I know you kind of already touched on that, but if you want to dive in a little deeper, that'd be awesome.
Yeah, I can jump in. I mean, and thinking about, I guess, gaps and how just I interact with students. I think as a whole, I think one thing maybe a lot of you can relate to is that I think Tulane students experience this comparison, right? We're always kind of comparing each other to our peers. And I think there's always an underlying layer there. And so I think sometimes that help-seeking behavior comes into play there of like, well, my friend doesn't need this, and like they're making all A's, so why do I need to ask for a coach, or maybe why do I need to ask for, like a therapist or anything like that? And I think you couple that with what we know traditionally from research that's shown, especially with, especially people who identify as men or masculinity, them asking for help. I think, you put those two together, it can kind of create a formula for not hearing from these individuals that we know may need the support. And so that's the gap I know I see as a coach. And that's always the challenge I think any of us have here or professionals on college campus. We always want to make sure we're reaching the people just in general that we know we're not hearing from, because that's typically the students that need the most help.
And I think that, I excellent things, everything that you just said. And just to kind of talk about kind of my work, and, I don't know the data and the numbers on who seeks services and who doesn't, but I do know kind of a little bit about just what research in general shows about masculine individuals seeking services. And one reason that they may not seek therapy is lacking really the emotional vocabulary to talk about what's going on, and really not even maybe understanding that what they're experiencing is a mental health problem. So for example, depression a lot of times in men looks like anger, right? It doesn't look like sadness. And so a man might not recognize that they're depressed because they're just very irritable and angry, and they think that depression means sitting around crying all the time. And so just really not having that vocabulary can be one of those things that kind of creates this difference in that help-seeking behavior and that kind of gap there. Other things is, that men tend to prefer different types of solutions. And so one kind of, they prefer things that are collaborative and group-based, and short-term and action-based and solution-focused. And so a lot of men don't see therapy as being those things, right? They see it as being going somewhere and talking about your feelings. And yeah, we do that. But we have a lot of different types of services that are available, and different types of treatment. And so, for example, at the counseling center, we offer a variety of groups, and some of our groups are very short term. They're like 4 weeks, and they're very action oriented. It's learning skills. And so you got some anxiety. We're not going to sit and talk about your anxiety and how you feel about it. We're going to teach you some skills so that you can manage it. And so, we have like a variety of types of treatment that really can meet different needs for different individuals. But I think a lot of times the gaps in people who are seeking those services are because not really understanding that and knowing the options that are available to them.
Following up after that, do you guys see any differences in how masculine identified folks or students respond to stress on campus and how they handle it?
Whether that be academic related or just general stress.
Yeah, I can jump in there. I think this actually plays on exactly what Dan was just hitting on. That is, I think a lot of times people seek the short-term solution, right? Like it's, I want to go, I need the solution now. And if we can't find it now, I think it's usually when I see someone, the biggest drop off in like coaching meetings, for example, is like, well, I didn't get a solution that 1 30-minute meeting. How helpful can this be moving forward? Especially as you kind of move into more stressful peaks, you're gonna need something to kind of give you that support. And it is a growing process, right? I'd be very impressed if you could kind of solve anything in 30 minutes alone. And so I think that's what I see a lot is, students just in general, as a general trend, is that who maybe are not able to recognize that it is a kind of a growing process. That doesn't mean we get to meet every week for the entire semester, but that may mean, hey, let's revisit this same subject a few different times and see how you're growing and how you're incorporating that. So that is something I notice on campus, just almost with anybody.
I think one thing that is kind of a difference as far as masculine individuals in kind of dealing with distress is sometimes, again, this need to be really action oriented turns into some really unhealthy coping. And so some of the unhealthy copings might be throwing themselves into work. And so on campus that can look like overworking themselves. And maybe there's something going on. Maybe they've lost somebody important in their life, or they've had a breakup, or just, they're not feeling good about how they're doing in school, just whatever kind of stressors that we all deal with. And instead of kind of addressing the problem, they'll kind of throw themselves and overwork themselves and just be taking on all kinds of new projects, and instead of really kind of slowing down and dealing with the issue. And so that's one thing that masculine individuals tend to do. But other unhealthy coping can be things like substance abuse and risk-taking behaviors, and that tends to be a thing that a lot of men turn to when they're in distress.
Yeah, both excellent points, and thank you for bringing up kind of both what you see in your experiences as well as what your training tells you about the differences that you might see, and possibly some reasons contributing to that trend. So I guess I kind of wanted to take it actually with the next question towards the substance abuse angle. How, Dr. Archie, for you specifically, since that's probably something that you see more often than you would, Logan, how do you think that masculinity influences substance abuse? You kind of touched on that just now with unhealthy coping behaviors, but do you think it's something beyond just stress and coping? Do you think there's maybe peer influences or societal norms or anything that you can touch on possibly that influences that? And how does, and then if you want to tag tail that, Logan, how does the substance abuse masculinity link, if any, relate to overall success at Tulane, whether it be mental health or success academically, that sort of thing? How are they related, I guess, if you want to talk about that?
Yeah, I think substance abuse can be seen as a way to cope, right? And that can be an issue. But I think that there also can just be a kind of cultural thing. And here, when you're in college, there can be kind of a party culture and that peer influence. And I think sometimes that can show up in parties of the masculinity of again, being tough and I can handle it, and really drinking way more than maybe necessary. Or really healthy for them, but again, it's almost a sign of their manliness, right? Of being able to do that, and so I think that sometimes that's how things can look, and as well as maybe just not really wanting to acknowledge that there's an issue, right? That you want to, again, part of substance abuse issues is being out of control of your substance use. That's one of the big symptoms that, okay, this is a problem, is you don't have control. And being able to admit that, hey, this thing has control of me, I don't have control of it, can be a really hard thing, especially if your identity is very much tied to being in control and being strong and things like that. And having to admit that, okay, yeah, I need some help with this, can be difficult.
Certainly.
Yeah. I'll tag on to that. Mostly, I can't really, I guess, in this subject matter, speak as a coach because, like you said, I'm not as exposed to it. But I can definitely speak from personal relationships and personal experience, and the fact that I also went to a school in the South, a very heavy party school, and I just know from my experience that think of all the friends that that I think it's worth noting. I know Dani can speak to this a lot better than I can, but when you're at that age going through college, you're at such a point of development, right? Like, this is, for a lot of people, this is the first time. And again, I'm kind of just speaking for myself here, but it's a point of time where you're actually getting a chance to really reflect on, like, who am I? What am I? What is my life experience up to this point? Like, what have I been through? And then, like, as you're kind of going through that, you start coupling that with these, like you mentioned, these peer pressure, this exposure to these new substances, and that can definitely, I can speak from experience, I've seen it cause kind of a recipe for disaster. And so, yeah, I think this ties in really beautifully into the subject we're talking about, is like, let's reach out for the support that we know we might need, because before you know it, you're kind of down that rabbit hole. So I think that kind of comes into play there too, is like what we're developing, what we're learning about ourselves as we're going through and coping in college.
Yeah.
I think another thing that keeps people from seeking help, but really anyone from seeking help with substance abuse issues, is really expecting like the therapist to be like a parent and like shame them, or say like you shouldn't be drinking at all, or you shouldn't be smoking at all, and that's kind of what they expect to come to. And that's not always the case, and we have a whole section of the counseling center, OSAR, that's focused on substance use, and part of it is some education. And so Julius is our guy that does that, and does an assessment and be able to say, okay, here maybe are some issues of where your substance use is causing some problems for you, and here's some ways to mitigate that, right? And that doesn't always have to mean 100% abstinence. And so I think that's another barrier to seeking treatment, is just or seeking help before you need treatment even is just thinking that you're just going to be lectured. And here's this adult that's just going to be like my parent. And that's not what we do.
Yeah, that's great. And in talking a little bit about the barriers that we see, and also you just providing some tangible solutions on campus, what do you all suggest as people whose work is to help students? What do you suggest students do when they find themselves encountering these barriers that we've been talking about internally, or maybe not even recognizing some of these barriers that they have to help seeking? What do you suggest that they do to try and start seeking help? So how can they sort of combat these barriers, both mentally and socially, that they might perceive or encounter?
I think one is just kind of reconceptualizing what seeking help is, and I think this kind of speaks to something that Logan was saying earlier about kind of like strength, and that seeking help can be a big strength, right? That it's hard to be vulnerable, and it really shows a lot of strength to be vulnerable and say, yeah, I need some help. And so reconceptualizing, it's not a sign of weakness. To need to come to the counseling center, to need to go to the student success center and get some support, that it's really a sign of strength. And again, being able to come early and get that taken care of before it gets to a place where it's out of your control, can really, really be a good thing. And so kind of realizing and incorporating that into your identities. Like, this is, as a man, it's important for me to take care of myself and to take care of others. And to do that, I need some support. And that's normal. That's where every human needs support. And so I think that being able to kind of connect that to your masculinity as opposed to it being opposed to your masculinity is one thing that people can do.
Beautiful.
Yeah, that was so beautifully worded. I'm not even trying to build on that, but what I will say is this is kind of like my kind of personal goal as, you know, working on a college campus is I want to normalize this as much as possible. You know, I want to say, you know, it's okay for, you know, people to relate to people what you're going through. You know, I think this comes to mind a lot is, if anybody here is familiar with Brene Brown. If you're not,
yes, Dare Greatly.
Yeah.
If you're talking about that book, I'm currently reading it.
Yes, it's so all of her work. Yes, yeah, and so all of her work I love. She even has a podcast now, and the reason I bring that up is because one thing she always asks people she has on that show is, "How are you doing? No BS." And I love that for so many reasons, and the fact that it's okay to tell people how are you actually doing right now. And I think, yeah, the more we can just talk about that, the better I think we all will be as individuals. And I think this ties also to what we were talking about maybe just now, is that I think for a lot of students, they feel like there is that fear of judgment, right? Like, oh, if I say here I'm going through this, I will be judged. And I can definitely I feel comfortable speaking for all professionals on campus that we do not judge, and nor are we really, you know, always here to tell you what you have to do. You know, especially I can speak for that as a coach. You know, I'm here to find what works best for you. And usually the individuals who you know are brave enough and you know strong enough to take that first step and engage that, and once they realize that, it's kind of a beautiful and freeing moment, right? It's like, oh yeah, like I can do this, and this is here for me, and I want to find what works best for me. So yeah, that's what I see a lot, and that's what I'm here for.
Wonderful.
I think even in addition to that of this fear of being judged, I think people fear judgment from their peers as well. And I think that, yes, there is stigma around mental health, around needing help in general. But I think that that's changing in a lot of ways. And the more people are open about what's going on with them, the more that changes. And people a lot of times find that when they open up to the people closest to them, they find support. Instead of judgment, they find support. And again, that might not be true for everyone in your life, but usually people have at least one or two people that are going to be there for them and aren't going to offer that judgment. And so I think that's another part of help seeking, is not just seeking help from professionals, but seeking help from the supports in your life. And that's one thing that we work on in therapy, is who do you have in your life that you can go to, you know, and just vent to, or just, you know, get some advice from. And so I think that that's important to realize too, that, yeah, it's scary to be vulnerable and kind of show your weaknesses, but chances are when you do, the person you're opening up to is going to be like, yeah, I understand, I struggle with this, or I struggle with these other things. And so I think that's important to realize as well.
Yeah, y'all are on point today. I think that that's also true, just that your friends might also have some tangible solutions that they can provide you with. And you touched on that before, is something that more masculine identified people might tend to prefer, is that sort of, okay, how can I get the solution? And yeah, it might not be that 30-minute thing that you were talking about, Logan. It might not be right away, but that is a great starting point. And I think then it might become something where they could evaluate, okay, do I need to actually go seek professional help? And is that okay? And then seeing that from their friends might be nice.
And
I'm gonna
also, I'll add really quickly too is, those support systems in your life, your friends, family, give them the credit, like give them credit. Cause I think I've had students share that to me so many times before, is they're so genuinely surprised when they actually kind of do show that vulnerability to their friends they may have made it here at Tulane. And they're so surprised that they received it and were able to offer that help. And they're always so genuinely surprised. And I think, yeah, give them the credit they deserve, and the people who aren't there for that, it's unfortunate, but those are the people that you kind of realize, maybe I don't need that person in my life, as difficult as that may be, but give your friends the credit. Cause I think for the most part that people want to be there for you.
I'm gonna turn it over to Chelsea now, but I totally agree with that.
I think we've covered a lot about this, but do you guys think there is an impact, of unhealthy behaviors and attitudes associated with masculinity when it comes to how they learn, how identified folks, develop in their future life opportunities as well? And do you guys possibly see this impact here at Tulane or at previous institutions you've worked for?
I'm not sure quite what you're asking.
Absolutely. So the impact, the impact of unhealthy behaviors and attitudes associated with masculinity.
Okay.
So on learning and development, and even as they have other future life opportunities, if that makes any more sense.
Yeah.
Yeah, I'm thinking too. It's a big question. Yeah, I'm trying to think how to formulate that.
And maybe too, I could ask, how do we think that maybe academic success fits into masculinity as well? So I'm just thinking about how does, I guess, I don't want to say the words toxic masculinity, but
Sure.
How does toxic masculinity impact learning and development here at Tulane?
Well, to kind of kick it off, and I don't know if this quite will answer your question, but I think, one thing I think we've all maybe seen some form or fashion is comes back into that box, right? That kind of rigidity where, as we're learning, there's kind of that, like, people who identify as masculine should be good at certain subjects, for example, like maybe it's math or whatever it is, and it kind of fits into that box. Like, oh, you should be good at these things. That's what, men are good at math, which I just, as a side note, and have no idea where that ever came from. But, I think that when we start talking about breaking down these boxes, right, I think that those boxes can kind of adhere to those learning styles and kind of show that, like, you should be able to identify that learning style or not. And the more we kind of break that down, I think the better it is. And I think it does have an impact as we kind of go through life. And I think it even has an impact on the potential major paths we choose, right? Like, of our career paths we choose. And so I think that's why you see, historically speaking, and thankfully, people in your generation are changing this in so many ways, but I think it's why historically you would see there be a heavy amount of, for example, men going into STEM fields, like engineering. Like, that's kind of always been this kind of classified as like, oh, engineers. That's obviously people identify as masculine. And so the more we can continue to break these barriers down of, like, that's not a thing, that doesn't have to be a thing, the better it is. But I don't know if that answers your question, but that's kind of where my
it sounds like, masculine identified folks are kind of expected to be more academically successful and to pursue, like you're saying, fields that involve math and engineering, STEM fields. So yeah, absolutely.
Perfectly summarized.
Yep.
And I think that, I don't know if this might be off topic a little bit, but I think men a lot of times a lot of their identity will be associated with their career, right? And so that can be like the major part of where their identities come from. And so if, for example, you're in college and you're not doing well, right? You're struggling in something that you're really wanting to do well. That's suddenly a big hit, not only to just your confidence, but your identity, right? And so that can really then spin you into a spiral and kind of some depression, because you're now feeling like, okay, who am I if I'm not good at this, if I can't do this? Especially, again, if you were a high achiever in high school and then you come here and struggle, which is not unusual. College is a lot different than high school. And so, but that can be kind of a very scary thing. And where I think women and more feminine identified people might have their identity tied to multiple things, and not as rigidly tied to their career, but careers and relationships and variety of things. And so, which I think is healthy for men to be able to do as well, and realize that they're not solely defined by their career.
Yeah, absolutely. And I think that kind of ties into what we've been talking about a little bit with that need for control, or that feeling of needing to maintain control, the pressure to be competitive and to have everything all together, which, like we talked about, relates to help seeking behavior and the stigma around it. So I absolutely see your point there. I think that's great.
Yeah, and to add to that, yeah, competitive is, I think, the key feature here of, like, I think men tend to be very competitive, which isn't always a bad thing. It can help you succeed. It can push you to do your best. But sometimes it can also keep you from seeking help from your peers because you're trying to beat them, right? And so instead of working together and being collaborative, you're trying to one up them, and you guys could maybe all do better together, you know? And so I think competitiveness is one of those things that you got to keep in check and be careful with. And men tend to be pretty competitive.
Yeah, absolutely. And kind of the theme of this whole talk seems to be that, you know, no one person can solve every problem they're going to encounter by themselves. And so, like you said, you know, we're stronger together. We are better off helping each other. And while competition is still very productive in some elements, can become unhealthy in other ways and can influence that. Certainly.
Yeah, and I'll just quickly add too. And this is something I definitely see as a success coach, is that, like, again, that comparison to that competition piece. And you know, one thing I always hope to challenge students, just in general, in a productive manner, is what are you really competing against? You know, at this, and I know that's something a lot of students, especially coming into Tulane, come from these highly competitive schools where you are really competing to get into, you know, prestigious universities. And so I understand where that drive comes from. But then again, taking that moment once you're in college to think about, who and what are you actually competing against? And it can be a strong motivator, but thinking about, you know, what am I actually getting out of this relationship with the competition or my competitors, quote unquote. And also think about, you know, I see it come into when students think about applying to maybe grad schools, right? Like, well, I'm competing against them. And I always challenge students, like, in a ways, you're really not. You know, you're really competing with yourself. You can only do the best that you can do. And so you show up with your best version. That's what you're applying for. You know, you're not really competing against your person next to you in your class. Not to mention the logistics of it. They're probably not even applying to the same school as you. You know?
Right.
Okay, so then I guess the last question that I have is geared more towards Dr. Archie, but Logan, you can add on to this too. How do you think masculinity norms affect the way that we think about mental health, and how it should, or what mental health should look like? How does masculinity and the way we think about masculinity affect how we think mental health should look?
I think one aspect is traditional masculinity tends to one of the traits is stoicism, right? Which is really kind of not showing much emotion, not experiencing much emotion, and really shutting down your emotion. Which again, we've kind of talked about that can be really harmful for yourself and to other people around you, because when you push down all that emotion, what comes out usually is anger. And really, men are very much often taught that that's the only emotion we're allowed to express, right? Is anger, and that's it. And so I think to have good mental health for ourselves, but also to, like, promote mental health of the people around us, where we're not harming people with our anger, is really challenging that stoicism. And that stoicism doesn't equal strength. And I think that's kind of one of the things that masculinity traditionally has told us, that if we shut down our emotions, it means we're strong. But being able to experience your emotions and, you know, use your emotions to guide you can be a strength as well. So yeah, if that answers your question.
Yeah, definitely. Logan, Chelsea, you guys have anything you want to add to that?
I'm absorbing that as well. I think that was so well said. And I think I'm reflecting on my own personal experience, like I said, and just kind of like when I was able to acknowledge that when like my friends or family, when they were vulnerable with me, how much that meant for me in so many different ways. And then also I was able to hopefully continue to replicate that, that emotion towards people, and there's so many different ways that you can do that in any of your relationships. Right. And, so yeah, that was powerful. I appreciate that. Thank you.
Yeah, and I think talking about vulnerability is important because vulnerability creates intimacy, right? And we can't be close to someone unless we're vulnerable. And so not being vulnerable, not showing those areas that we struggle with, really all that does is isolate us, right? And it keeps us alone. And that's not good for anybody's mental health. We're social creatures. We need each other. And so, yeah, I think that being able to be vulnerable really is a strength, but it also brings us together. And that's one way that it promotes mental health.
Yeah, I think that's spot on as well, and I think that it not just breeds intimacy with possible romantic interests, but also with friendships. Like all around, if we cannot truly express how we are feeling and thinking about something, and we can't appeal or help or for another perspective, how are we expected to grow? How are we expected to connect? What impact can we really let somebody else have on our lives and us on them if we don't do that stuff?
Absolutely. Well, I don't have anything to add, but from a feminine perspective, as a feminine identified person who's also struggling with vulnerability, I can imagine that our masculine identified folks are also struggling as well. But it's really awesome that we're talking about this is just, messages I keep hearing lately is just opening up and connecting with others, because you get to a sense of I am because you are, those types of like we are one. And I really feel that, unhealthy masculinities or the behaviors and norms that come with that really like separate us from each other. So I really appreciate that you brought that up, that it's a very important part of our mental health, and it's very important, especially for masculine identified folks. So we're gonna basically wrap this up, but you both kindly agreed to be a part of the Mentality Project today. Again, we really thank you. But just to close it out, I want to ask why you both think education around masculinity matters, and what form would you both like to see it take on at Tulane?
I think it matters for all the reasons that we talked about today. I think it matters for people's health and wellness and relationships and just ability to succeed, all these areas. I think that healthy masculinity is important for. And how I'd like to see it at Tulane, I think that a lot of different ways. I think that men being able and masculine people to be able to come together and be open with each other and be vulnerable and talk more about these things and how it affects them. But also looking as well as at our relationship to women and how women are treated as well, and feminine people are treated, and being able to break down some of the harmful ways that men have traditionally treated women. And so I think that's an important aspect as well that I'd like to see on campus.
Again, so well worded. I think that's exactly right. I think it does matter because we were just now touching on, we are all in this together. We are here together. So how we choose to identify and portray ourselves and the relationships we have, it impacts so many different people. It's not just one degree; it's several degrees out, and it kind of can replicate itself. And that's what I would challenge. Any masculine identified individual in my life is to think about, how are you showing up? How are you relaying this identity? Even when it comes down to maybe some of these micro transgressions you might have. It can be something small, like how are you showing up? Maybe it's speaking over somebody who identifies as like female in your life, speaking over them. Really, that's a small thing, but kind of keep an eye on those things and realize what that can mean for that person. So that's what I would challenge people to think about, is like, how am I showing up? How am I being present? And what kind of human am I being around other people?
Love that. You want to wrap us up, Magnus? Any last words?
Well, thank you both so much for being here today. I really appreciate this conversation. It honestly went better than I could have expected or asked for.
Yeah.
I think the perspectives you both brought today really, really gave us a lot to talk about, gave us a lot that hopefully our audience will engage with and recognize. I think there are a lot of little nuggets of truth and little phrasings that just really struck me personally, and I think would hopefully strike the audience in a good way and encourage them to start talking to their friends about how they're feeling and the people in their lives. Start looking at themselves and asking themselves how they show up, looking at themselves and asking themselves what components of unhealthy masculinity are they exhibiting and what components of healthy ones can they exhibit. And just sort of starting to branch out and hopefully, if they need it, reaching out to the Counseling Center and reaching out to the Center for Student Success. So thank you both so much. Really appreciate it. And that's all I have to say. Until next time.
Yeah,
Well,
we'll see you guys next time.
Yeah.
Oh, yes, please, if you guys have any, last words.
Yeah, I was just gonna say thank you so much for like doing this work and creating this platform for people to hear. And I'll just close out by saying, like, honestly, I'm not that much older than all y'all, but I am truly inspired consistently how y'all's generation and the newer generation coming in is how much of a difference you are making, how much of a difference you are showing up and seeing things change. And I mean that like in every category. So that's the hope I get, is seeing people who are actually changing and making this difference like yourselves. So I just want to convey my appreciation for that.
Yeah, I will co-sign that. I'm glad to be here and have this conversation, but also just glad that this conversation is happening and that you guys have kind of done this work to make this happen. So good job. Keep it up.
Yeah.
Take all of us.
Thank you. And thank you guys again for all the work that you do. Please keep it up as well. We need y'all. So.
Thanks, y'all.
All right, guys. We'll see you next time. Okay.
Bye.